Good morning, doctors. Welcome again. Today we are going to discuss about meningioma. What is meningioma? Meningioma means meningoepithelial cells. Tumor, we can say. Oma means tumor. Meningioma. Its origin from meningothelial cells of dura mater. Meningioma originates from where? Meningothelial cells of dura mater. Primary in adults. In young adults, we see this meningioma. This is benign, not mostly benign. Usually cranial, maybe spinal. It is cranial, but sometimes it's spinal also. A patient has a history of neurofibromatosis type 1, or this is more common in women. Meningioma is more common in women, and history of neurofibromatosis we see, and meningothelial cells of dura mater origin benign. Okay, symptoms, stereotypic symptoms like seizures, morning headaches, impingement on local structure may cause weakness and apathy. Impingement on local structure cause weakness and apathy. Okay, how to diagnose such tumors? Initial primary stage we go for CT scan. However, MRI is more accurate, whereas the most accurate test and required for formal diagnosis, that is biopsy. Biopsy is a gold standard, we can say. Usually on MRI, a dural tail is visible connecting the tumor to the meninges. Dural tail is visible connecting the tumor to the meninges, and the treatment here is by surgical resection and surgical resection. Prognosis is quite good, but recurrence common. However, so what do you understand from this? Meningioma. Yes, see, meningioma. We see dural here. This is the tail, and this is meningioma. Originates from meningothelial cells of dura mater, and this tumor common in cranial, but sometimes in spinal. More common in adults, but it is benign. Remember this meningioma. And meningioma associated with neurofibromatosis type 1, more common in women's. This is tumor is common in women, and this meningioma diagnosed by, we can say, CT scan initial, then MRI, but most accurate, that one is biopsy. Symptoms we see like morning headaches and seizures in patient, and impingement where the structure involvement, apathy and weakness. How to treat by surgical resection such meningioma. Prognosis is quite good, but what more happens, recurrence is a common. So guys, I hope it's clear about you meningioma. If you have any queries, any question, you can ask me. If you're new on my channel, please subscribe it, and if you like this video, put like on it. Thank you, good day, goodbye. That's all for today. Okay.